All right. I'm going to kick us off for the sake of time. I do expect several folks to be rolling in as we get started. So welcome everyone to the very first Pathways Community webinar. Through this quarterly series, we aim to share insights from across the Pathways community and provide a virtual space for connection and conversation. If you are new to Pathways, welcome. We're really glad that you're here. Let me briefly describe Pathways and how it can help you design and implement targeted RNMCH programs. Pathways is an innovative initiative and it helps bridge the gap between social determinants of health and actual health outcomes. It offers a practical, design-driven approach that makes these often overlooked factors easier to understand and act on. By using a segmentation model, Pathways helps uncover the different ways health challenges show up across the population. This gives us richer insights, not just into who is affected, but how and why, so we can design more targeted, more effective solutions. Pathways is used by governments, implementers, donors, and academic organizations to inform strategies and design health solutions that are truly responsive to the lived realities of the people they serve. Pathways is led by Sonder Collective and funded by the Gates Foundation. So before we dive in, just a little bit of housekeeping. Please keep yourself on mute. We really encourage you to use the chat feature to share comments, to ask questions, just share how today's presentation is aligning with your work. We're hoping this can be a robust way to connect with each other. So let's go to the next slide. Before we dive into just the overview of the agenda, I failed to introduce myself. I'll be introducing our speakers shortly, but my name is Amanda Bendor. I am the engagement lead for Pathways, and you'll see my face a lot on these webinars and see my name in reaching out to you all. I met several folks who were at the convening for Pathways in Nairobi last year, if you were there. And if you're excited to engage more in Pathways in the year ahead, hopefully you'll see my face, maybe even in person, as we have a lot of events coming up. So let's look at our agenda for today. First, you're going to learn more about the Pathways typing tool. Simply defined, the typing tool is a set of questions asked in a very particular order to help us group a person into a segment. But it's a lot more than that. You'll learn how the tool helps you move beyond averages and statistics to understand the lived experiences that shape women's health outcomes. Next, you'll hear about the Digital Personas Project, an exciting extension of the foundational Pathways research. Building on segmentation work in Kenya, Nigeria, and Senegal, this project uses rich data to develop detailed personas that capture how women access and use digital tools in their everyday lives. But it's more than just describing patterns. In this presentation, you'll learn how the personas help us understand the depth of digital inclusion and how that understanding can shape more gender-responsive technologies that support women's health, livelihoods, and agency. In the final session, we will shift from tools and insights to impact. Despite years of effort, family planning uptake in Kano State remains stubbornly low. Today, you'll hear how insights from Pathways helped change that. You'll learn how Pathways' family planning strategy was reshaped with a more targeted, evidence-based approach, and what's next for delivering more effective, equitable services in the region. Following our presentations today, we'll have a discussion. Please post your questions in the chat. We'll revisit these in the discussion portion of the webinar, and you may also get some of your questions answered throughout the session. Finally, before we wrap up today, I will share a few updates about how to continue your engagement with the Pathways community. Before I introduce our speakers, I would like us to take a quick poll so we can just gauge your knowledge of Pathways. So if you give me just a moment to navigate this, I'm going to launch the poll. All right. Can we see the poll? All right, I see folks are already answering the questions. This is great. Few more answers are still coming in, and then I'll share the results with everyone. All right, looks like we have quorum. So It looks like we've got a mix of folks here who are really knowledgeable of Pathways and have potentially used the Pathways project, to folks who were somewhat, new to Pathways or learning maybe about Pathways for the first time. So this is great. We hope that we have something for everyone in today's presentation. So let me get to our presenters today. Oluwapelumi Adeyera is a research specialist with a decade of experience in humanitarian and development sectors. She specializes in research and program design and implementation within low and middle income countries. She has extensive experience in designing and implementing robust research frameworks, conducting rigorous mixed methods research, including both qualitative and quantitative data collection and analysis, and using a variety of research tools and methods. Babitha George is a director at Quicksand. Quicksand is a multidisciplinary design research and innovation consultancy that has been working in emerging markets for over 20 years. Quicksand's work is anchored in an HCD approach that transforms rich, evocative understanding of people and contexts into products, services, technologies, and interventions that are future-facing and deliver high impact. We're also joined by Daryl Collins. She's the founder and CEO of Dakotas, a technology company which has developed voice analytics to understanding the thinking and emotions of hard-to-reach populations. She is a well-known thought leader in understanding the behaviors of vulnerable people. Daryl describes herself as an innovative and empathetic researcher. She is the creator of the Financial Diaries methodology and developer of a copyrighted diaries application. Dr. Sara Damusa is a leading public health expert with over 25 years of experience designing and scaling high-impact health interventions across Nigeria. He currently serves as the technical lead on public health and nutrition in the Office of the Vice President in Kano State and is the CEO of the Development Outcomes Support Center. In these roles, he provides strategic guidance on national health priorities with a focus on sustainable nutrition and family planning programs. Dr. Sara has been instrumental in advancing policy reforms, strengthening coordination mechanisms, and integrating evidence-based practices into Nigeria's health systems. He is also the managing partner at Scaling Scope Consulting, where he supports governments and development partners in achieving transformative health outcomes. We're really excited to have the speakers and to have these great presentations today, so I'm going to kick it off to Palumi to get us started on the typing tool. Over to you, Palumi.
Thank you very much, Amanda, and welcome everybody. It's a privilege and honor to be here. As Amanda said, I'll be talking on understanding and applying the Pathways typing tool. If you are going to apply the Pathways segmentation to your work, or you have already started applying the Pathways segmentation, the Pathways typing tool is an important resource that you are likely not going to miss. It's one of our very strong resources that you need, when applying the pathway segmentation. So what exactly is this Pathways typing tool? It's a set of questions asked in a specific order. And what it does is to place individuals into the pathway segment using a statistical model. So in layman terms, how does that work? It means you're asking individuals, respondents, a particular set of questions. Could be what's the level of education you have? Where do you cook? Where is your toilet located? Questions like that. And based on the responses that they give, they get to be typed into a particular segment for that particular geography. It can achieve up to 80%, over 80%, sensitivity and specificity when placing people into segments if asked, correctly. And how do we have this typing tool? The first is a decision tree, which is just like a PDF format. In the past, we've had it in Excel format, but currently it's in PDF format. It's just a visual, printable logic guide that shows how the questions go from one to the other and what responses the respondents will give that will make them, get asked another question or maybe, get typed particularly into a segment. The other format is the Pathways Collect app, which is the application that is built for collecting for digital recruitment for those that are on the field. Otherwise, if one of our partners, if you have your own ODK form and you don't want to use the Pathways Collect app, we also have the ODK compatible XLS form, which you can integrate in your own data collection software. Next, please. Okay, so this is just an example of the typing tool. So on the left-hand side, that is the decision tree that I was mentioning the other time. You could see how it shows the different questions and the responses that the respondents will give that would make them get typed into that would make them, either get typed into the segment, yes, or get another set of questions, and then it goes on and on and on. So it is, even though you would see a typing tool that have up to maybe 10 or 15 questions overall, it is likely that a particular respondent may not, get to answer all of the questions because he or she, or rather she, gets typed into the particular segment early on based on the responses that, that was given. And on the right-hand side is just a snapshot of what the Pathways Collect app looks like. So in the next slide, we are going to be talking about the application of the typing tool itself. So yes, we're talking about the typing tool, but what exactly is it used for? How has it been used across, the different projects? The first thing, and I think the basic first thing that will probably come into everyone's mind is the recruitment of participants from different specific segments. So how this works is if you do not want to, rather than just go into the field or into a particular geography and you just want to talk to everybody, you could decide that you want to talk to specific segments or specific set of people, and the typing tool would help you recruit, directly from there. An example is the Northern Nigeria family planning intent to use projects, where we were able to recruit particular, segments that we wanted to talk to. So we wanted to talk to the least vulnerable, more vulnerable, most vulnerable women based on where they were on their own intent to action journey. And rather than just talk to every woman and assume everybody is the same, we decided to recruit based on segments, and also did all of our analysis, data collection through the segmentation lens. In the other application, you would see embedding questions in a survey to analyze data by segment. This was done by one of our partners, the Solina Group and the Village Reach team. They had a baseline survey and they incorporated, embedded the typing tool questions into the survey questions. And this enabled them to have a segmentation framework for their analysis, enabling them to have, richer insights. Apart from the survey questions that they had, they were able to look at it through the segmentation lens because they embedded the typing tool questions into their own survey tool. And so beyond insights, beyond research, in the next slide, you would see other uses. And the next one would be the ability, if you use the typing tool, you're able to also compare segments, thank you, across the different data sets. And Babitha and Dario will be speaking directly to this after me. What this does is it allows you to conduct analysis across multiple data sets. For them in Decodis and Quicksand, they were able to, they combined a deep listening AI-powered methodology, and they were able to compare insights across across different data sets using the same set of people because of the typing tool that was used. And then the other part is being able to analyze existing data by segments. This was also done by another one of our partners, Ariadne Labs, in the Beyond Survival study. So this was like I would say this is like a retrospective use of the typing tool. So it was a longitudinal study, and they had gone to the field earlier. And then in a follow-up study, they decided to include the typing tool as part of their qualitative study. It was even a qualitative study, so they asked the typing tool questions in the follow-up study, and this enabled them to be able to gain additional insights on why, the responses they were saying differed and why it differed across the different segments that they were saying. So beyond research, beyond data analysis, you can also use the typing tool in service delivery. Yes. And this has been seen in also different ways. One of such is being able to deliver different services based on segments. again, if you realize I'm giving examples so that we are able to relate with what this really looks like on the field. Jacaranda was using an adapted SMS typing tool, and what they did was use it to able to understand the different prompts platform user and how their needs differed based on their unique journey. So based on the responses that the respondents gave, they use that to serve a particular service, to them, or a particular content to them based on the responses that were given. So they were able to know what segments and which particular service would serve this particular respondent, better, rather than just serve the same content to everybody. So you are able to deliver different services based on segments. You are able to know what will actually work for this particular segment and deliver your services, in a targeted manner. And then also, as part of service delivery, you are able to also using the typing tool also enables you to include questions that can help you measure intervention coverage and impact by your segment. The Solina Group and the Village Reach team, again, also did this. They embedded the typing tool questions in their enrollment processes. And so they were able to understand which segments were using, the 3 implemented solutions. So they have 3 implemented solutions. And because the typing tool was embedded in their own enrollment tool, they are able to know what particular solution was working for which segments, and that would enable them to course correct if there's any need, or to understand why a particular segment was using this solution compared to the other solutions. So those are the different ways by which you would use the typing tool. As a recap, you're able to, first of all, recruit participants from your specific segment. You're able to embed questions into your survey to analyze data by your segment. You're able to compare segments across different data sets. You're able to do it retrospectively by analyzing your existing data by your different segments. You are able to deliver different segments, deliver different services based on the segment, and you're able to measure intervention coverage, intervention impact by segment. You would agree with me that these are really amazing uses of the typing tool, and it's like very endless. It just feels like this tool that enables you get richer insights from your data rather than treating everybody as the same. So in using this, what are the best practices for implementation of the typing tool? You have to, first of all, make sure you're using the right version that matches the segmentation you're using. So the segmentation solution are different for different geography. Even within a geography, you could have different typing tools. So make sure you're using the right version, and then make sure you follow your question order and the phrasing, to maintain your accuracy, and make sure that your translation is done centrally. So it's not going to be optimal if you have your recruiters having their own version of translation. Everything has to be done in a way that makes sure the phrasing is still intact. And then when you're doing your urban rural classification, make sure you use the DHS, definitions. And lastly, I'll just, run through in less than a minute how you're able to get access to this typing tool. Next, please. Okay. I don't know if it's me, but I'm here to see the slide, but let me just go through it. There is a dashboard which is on the screen, and then once you click on the screen, you're able to see, this is just right now a dashboard of resources. We're working on an MVP. We're working on the MVP platform, which would be rolled out in a couple of months. But right now, this is how you're able to access your resources. You see the different geographies. Click on the particular geography, and then when you do that, you're able to see the available typing tools for that particular resources. And this differs from geography to geography. Some geographies you see just one typing tool, some other ones you see different typing tools. And so when you click, I don't know if I'm the one not seeing it move.
We can see them, Palumi. Yeah.
Oh, it's probably from my end, and so I'll just go through from my end. Thank you. So when you get to the typing tool page, you see the different resources. There's also a notes per version. So you just read it and you're able to know when this particular version was created and what about this version. Click on the download links. It takes you to a particular form. And then when you see the form, you are able to, fill in your information and click exact version that you're looking for. And within a minute or two, it drops into your email. When you even get the email, there's more information on how to use the typing tool and who to reach out for support. So thank you very much. And I hope I was able to interest you in using the typing tool, or at least, make you understand the different, ways by which you use the pathways typing tool. Thank you.
Great. Thank you so much, Palumi, for demystifying a lot about the typing tool. It's a great technical resource and technology to both paper and digital to help get more information for the segmentation and qualitative data analysis. So next, we're going to deep dive into the digital personas project. Bhavitha, can I ask you to take over?
Thanks, Amanda, and thanks, Palumi. So Daryl and I are going to present together. I'll start off. But before we do, I just wanted to say that Daryl and I are presenting today on behalf of a really large team across Quicksand, Decodus, Yux Design, and of course, Gates Foundation, including Tracy and Carol. We're very, very happy to be sharing this work. We're right in the middle of the Digital Personas project. So we're really keen and happy that we get to share some of where we are and hope to stay connected with all of you as we move forward with this work. Next slide, please, Damaris. Yeah, so digital personas really looks at how we can make more gender intentional technology to empower women. As most of you might already be working or are familiar, there are multiple stakeholders across funders, implementation organizations, governments, private sector players, etc., who've really been looking at how technology can be leveraged for social good and particularly for women's empowerment. And we've been trying to kind of, over the years, looking at how technology can be made relevant for women and how digital can unlock new opportunities for women. So the Digital Personas project really seeks to build on the pathway segments. We'll share a little bit more about how we're doing that, to really think about how we can capture nuances of women's digital access and use, including some of the barriers that come in the way, how women pursue the value of digital, how norms affect their digital use, etc. And we want to create these personas really as actionable tools for anyone seeking to build technology that is more gender intentional. So this work is currently happening across Kenya, Nigeria, and Senegal. Next slide, please, Damaris. So this is a really quick overview without going into too many details. We wanted to emphasize how we're tying in with the pathway segments. So like Palumi said, we are using the typing tool to actively recruit and find women within the segments. But more importantly, we're also really using the underlying vulnerability framework of pathways that Amanda introduced in the beginning to build up the digital personas. So as many of you know, and as Amanda said, the segments in pathways looks at the various drivers of vulnerability and how they drive health outcomes for women and her household. The personas will actually look at how digital can act as a catalyst to enable better health outcomes as well as better livelihood outcomes and overall empowerment. So the personas will map to the pathway segments and the vulnerability levels. We imagine that some personas may go across segments and some segments will actually have multiple personas. So they're really acting as a bridge, the personas, in making the pathway segments actionable for those who want to make gender intentional technologies and to really make digital a catalyst for women's health and livelihood outcomes. Daryl, can I invite you to share a little bit more here?
Sure. Thanks, Papita. Hi, everyone. I'm Daryl Collins. And as we mentioned, Dakotas is working with Quicksand. And on the next slide, we'll just talk a little bit more about how Dakotas is blending together with Quicksand to create these digital personas. So what Dakotas does is we collect data at scale from low-income women, and we do that with a voice survey where we have a recorded, highly localized local language voice asking the questions, and then respondents just talk as responses. So in that way, we're getting voice clips, which we turn into text, and we have clips, therefore, of qualitative data. Now, we're matching that qualitative data from Dakotas to Quicksand's very deep, thick, bottom-up sort of very thick, smaller sample data, but with all their deep observations. And in that way, we're getting both the value of quantification and that very deep, thick understanding that Quicksand brings. And so the way that we're meshing these two methods is that both of us are sampling on using the typing tool so that we know what pathway segments we're sampling and bringing into both samples. But even from there, we're meshing our methodologies even more. So Dakotas is working off of sample sizes of above 1,000 low-income women in each of the countries, in each of Kenya, Nigeria, and Senegal. And then Quicksand is doing very deep dives into about 300 low-income households across the same countries. And we're blending those by taking our initial surveys and then using some of those to provide inputs into Quicksand sampling, and then working back and forth, collecting qualitative data that's blending together and ultimately will create digital personas. So let me hand back to you, Babita.
Thanks,
I
Daryl.
think we can go to the next slide there.
Yeah, thank you. We're not going to go into all of this, but because we don't have the time, but we will try and give you a little glimpse of exactly the kind of mixed methods approach that Daryl was talking about, how the two methodologies are coming together to really unpack some of these themes and some of these notions and really look at understanding women's experiences around this deeply. So what you see on the slide now are at a really high level, some of the themes that we're working with, but within each of these, we're going into a lot more detail. We'll give you a glimpse of that in the next few slides. Damaris, the next slide, please. Yes. So this is something that we've been thinking about quite a bit, and a lot of you might have heard about how adoption is a critical hurdle to get women onto digital tools, digital devices, etc. But through our research across both methodologies, what we found was that digital access is not a one-time affair. It is also not a stable or continuous experience. It's actually for the women that we want to work with and across the pathway segments. Digital access is really marked by frequent disruptions that actually make phone use quite unreliable and inconsistent. So there are many, many reasons for this. Many of them have cheap feature phones. They break down. Smartphones that are purchased on credit, especially in Kenya, can be locked when payments are missed. Airtime and data are often bought in really small bundles. So there are often recurring interruptions in data access. The physical demands of the lifestyle of a lot of these women also leads to frequent phone damage. So there are several aspects such as this, and these discontinuities itself can be short-term or long-term, with, again, varying types of impact. Some disruptions may just last a few hours or days versus others, such as having to sell a phone due to financial distress or having to actually face long-term restrictions from a controlling partner, can last months or even years. And we wanted to really unpack this. Now, if you take even just one type of discontinuity, like control and coercion, there are several patterns to this, obviously. And what we're doing is really looking at how the vulnerability framework that this pathway segment presents us is enabling us to look at this with a new lens. And Daryl, if you could add in a little bit there about women responding to control and coercion.
If you think a little bit more about control and coercion and how this reflects on what women might do that adds to discontinuities, a large part of what we're finding, and it maps very nicely to what Quicksand is finding, is that women can pull away from digital. They can sort of self-restrict if they feel like they're in danger from their digital demands, and that creates another type of discontinuity. And so we're finding that there are lots of ways that women's use get interrupted. We don't have this nice, smooth stream of constant digital use that we experience in our own lives.
Damaris, if you could go to the next slide again, and maybe the next slide again, because we just have about a minute left. And again, this is another theme that we've been unpacking together, which is really around safety and security. Again, maybe going deeper than several of our perceptions and conceptions around how women think about safety. It really isn't solely about an event that happens on digital. It isn't episodic. It isn't solely about being bullied or trolled online. There are several aspects to this. And what we've also therefore been unpacking is how the vulnerability lens adds to this, and what happens when there is how less vulnerable women are able to often pair their awareness of safety and security concerns with agency, versus when you are much more vulnerable, they actually end up expressing fear. They often rely on mediators and folks in their spheres of influence, and that ends up being an even worse experience for them. And similarly for things like exposure, how they're able to deal with exposure to negative events, the kind of autonomy and support that they have. What this means is that if we think about designing for digital safety security for these women, we will need to take into account these kinds of differences. I think the point of the pathway segments, as well as the digital personas that we're trying to layer onto that, is that women's experiences and their values and their motivations and their barriers aren't homogeneous, and we need to recognize that in order to be able to design for them. And the final slide, over to you, Daryl.
I'm just going to briefly mention on this, because I know we're running out of time. We have also looked into some of digital and health seeking. And what we're finding so far is that there's a lot more digital being used for health seeking than we might imagine. Now, we do have some data that takes these numbers and puts them across, divides them by pathway segment. But we still want to sort of stress test those a little bit more, because it's showing us a good amount of homogeneity, which means, okay, well, what does that mean about digital capabilities vis-a-vis the vulnerability in pathways? So how do we tease those things out? This is something that we're working on at the moment. And I just do see a question in the webinar chat, which I'll just answer very, very quickly, which is, so Lee asks about how we subdivide the segments into personas. So those personas haven't been developed yet. All the work that we're doing now, which is tied into pathways, we're going to be pulling together and creating digital personas from it. So it's a watch this space for the moment.
Great. Thank you so much, Babitha and Daryl, for co-presenting such an engaging and informative session on your project. We know digital technologies have the power to transform health services, and the insights from this project, I think, will benefit many programs using digital as an enabler in the future. All right, moving us forward, I'd like to welcome Dr. Sada to share how pathways influence the family planning policy and strategy in Kano State. So over to you, Dr. Sada.
Thank you very much, Amanda. And thank you everyone for attending, and thank you very much for the opportunity. So as Amanda introduced, my name is Dr. Sada Damusa. I work in Nigeria. A little bit of clarification is that I currently serve as the lead of the technical team at the office of the Vice President, not in Kano State. In Kano State, I was more like a consultant that supported this process. And I did that for Kano State about 10 years ago, where I supported the first contraceptive, the first costed implementation plan. And I also did it for Kano State recently. But I think the key thing is on this one, Pathways method allowed us to be more strategic in how we target women that are largely unreached before now. So I have the context of for over the first 10 years, and I see how beneficial it is. So the slide we do have now is really showing how low MCPR has been in Kano. In fact, it's one of the lowest globally, as whoever has worked in Nigeria must have known. I just put a slide there on the first frame is trying to show the MCPR in Kano compared to Lagos State in the last NDHS in 2023 that just came out in 2024. But I think for us, the more worrying situation is the rising unmet need in Kano State. So even though the situation is improving for MCPR, there is a rising number of women that express the need to delay or to use contraceptives but are not accessing them. The last part of the slide is showing that this is really not for lack of effort, because the state has been very up and about in coming up with policies, adapting national policies, making contraceptive free, doing the tax shifting and tax sharing, so that more lower cadre providers can reach people. And there are a number of very major donor-funded programs over the last 10 years. And that is really why we feel that this is not just an issue of effort or an issue of access, but really significantly also is an issue of approach. And that is where the Pathways methodology came in handy. It allows us, as we can see in this slide, to see that women in Kano are not really homogeneous. They are significantly different. I will just take an example with the health system engagement and compare the urban male-headed households among the segments with the rural male-headed household. That is the second to the last column there. I don't know if you can press again so that I see. Right, so please go ahead again. So I try to compare the health system engagement between these two groups. It is clear to see that up to 90% of women in the rural male-headed households have answered to ever delivered at home, compared to only 34% in the in the urban male-headed household. I mean, this might not seem very significant until you look at the data the average data for the state, which you have been using in the past. Importantly, also, if you look at the urban male-headed household, they are only 2% never had an ANC. Now compare that with about a quarter of women in the rural male-headed household. Now, what this is showing is the fact that the pathways has shown us that there are a lot of barriers and drivers that differ between different segments of the population in Kano. And it is not surprising that when you look at the uptake of family planning, you will see that in the urban male-headed household, for example, about 19% of them are using modern contraceptives, which is almost 4 times higher than similar male-headed households in the rural areas. So this is really important for us because understanding these segment-specific challenges really allow us, when we're doing this strategic planning, to better prioritize and to develop more targeted strategies to overcome the barriers. Can we go to the next slide? So this slide really is showing us a dashboard that facilitated the state to be able to use the data from pathways to take decisions. Is a letter, is a letter development, because the data as presented was making it a bit challenging for the state. So Pathways was able to develop this dashboard, which bring group segments with similar outcomes and vulnerabilities together so that it is decision making. So doing that, it is easy for the state to see that a group, the rich fatalists, which is at the lower level of the slide, now the lower column, you can see that it is easy for them to see these are group that they should focus on. For one, they form significant part of the population, 46%, close to half of the population, but they also bear the disproportionate burden of health outcomes. So if you look at the under 5 mortality rate, you will see that it is 196.5 per 1,000 live birth. Now compare that with the worried potential at the top of the table, which the under 5 mortality rate is only just about 63.6%. But beyond that is also the fact that they have this worried, these rich fatalists, they also have very low exposure to the media, right? As you can see on the slide, and almost only 2% of them own smartphones, right? So beyond the fact that they have low exposure to the traditional media, they also have the lowest ownership of smartphones, which will allow them to also engage in social media. Now compare that with the women in the worried potential, the urban women at the top, with 41% of them own smartphones. But I think for worrying for us at the states, as we are supporting the states, is when you look at the justification of domestic violence as a result of refusal to sex. Almost a quarter of women within the rich fatalist justify that, yes, domestic violence is okay if they refuse sex. This slide is basically just to show you how the dashboard allow us to take decisions with the state. A lot of who do not have a lot of time to be able to look into the data. So the dashboard was very, very useful for that. Can we go to the next slide? So this is really to go into what the dashboard has allowed the state to do. 2 things. One of them is more focused prioritization of a group of women. It is easy to see that the rich fatalists are really what the Kano state will want to target, even though it was a big trade-off, because these are a group of women who will require more effort to be reached. They also require more resources to be able to get services to them. But the state figured out from the data that because they carry the highest burden, but also because they have high potential for impact, being that given that they have very low use of contraceptives now, if you are able to get them to use, you will have more impact overall than if you target a small population of women in the other segments. But additionally, it was also the potential that if you target them, you have the potential to also have a knock-on effects on the other segments, because some of the vulnerabilities are really across board. So the state focused on this unreached fatalists. And by doing that, the state was able to see that they are targeting over 65% of women of reproductive age in the state, most of which are previously unreached. So can we go to the next slide? So this is really, where we have, the second component of the benefit that the pathways provided. So beyond prioritizing the target population, they also allow us to shift the strategies from more general, one size fits all, to more targeted strategies. I will give just examples of 3. One key insight we had from the research is the fact that religious leaders are really central to building male buy-in. And when you look at the unreached fatalists, one of their major issue is even forming the relevance, forming the goals to be able to say this family planning, use of modern family planning is relevant for me. And one key important factor that will allow that is if they are able to discuss family planning and contraceptive use with their partners. But we do find out that partner interest is very low because, of course, there are a lot of gender issues that women go into the home with. But what we found out also is the fact that religious leaders are really very, very important, very trusted, and they have a lot of potential to legitimize family planning discussions within the family. So one key shift we have is to do male engagement through the religious leaders and getting the religious leaders to frame family planning within religious discussion. Another example we did was from the insight that, adopting strategies. So most of these women in this unreached fatalist group, they have very low self-efficacy. And because their problem is really even forming the relevance, and they needed close friends, the people they trusted for them to be able to do that, we focused on working more closely with community actors that they trust very much, like female patent proprietary medical vendors, female TBAs, and especially female religious leaders that will support them to take decisions and mobilize for family planning. I think one other example that I'll give, which is really very, the state really liked it, was reframing the messaging around spacing, right? So instead of pushing family planning to limit your size because of financial issues and all of that, we reframe the messages to be more related to the culturally acceptable resting period between birth. Because the research showed that, every woman abhor limiting, basically because God doesn't want that. But in the same sense, God encourages or God likes women to rest because that is related to their health. So we work with the state to reframe messages towards resting rather than towards limiting or just overall generalized messaging related to family planning use. I think this should be the last slide. So thank you very much, everyone.
Thank you so much, Dr. Sada. This is excellent work, and really appreciate you taking the time to share all of these insights and how they've been impacting strategy and policy in Kano State and in Nigeria. So we've got just a few minutes, everyone, for a discussion. I know it's hard for you to see who else is on the call, but we've got about 40 folks on the line. Please do post your questions in the chat, and we'll get to as many as we can. We had one come up about the Digital Personas project. Amelia asked when you all anticipate having the personas ready and whether they'll be available for other organizations to share.
We're hoping, definitely that the whole point to them is to share with other organizations and to have it be a tool that others will use. And we should have them for Nigeria and Kenya ready, I think, to release by the fall.
Yeah.
And then Senegal for Kenya and Nigeria, and then for Senegal a month or two later.
Great, thank you. I've got a question for Palumi about the typing tool. How long does it take to implement the typing tool to collect data?
That would depend, but most of our typing tools are not so long, so somewhere between 3 to 7 minutes, I think, on the average, depending on the responses, but it could be 2 to 7 minutes. The range, that's not an average, that's a range.
Thanks, Palumi. I know I figured it was different, but I wanted a ballpark. Please post any other questions in the chat. I know we shared a lot of information. Several of you have been asking about the slides and the recording, and we'll make sure all of that is available. Yes, Babitha.
I was just going to add, because Palumi talked about the typing tool, how we've used it, and I just wanted to give a shout out to the Sonder team in helping us also integrate some of our questions, because we had the typing tool to figure out which segment the women were from, but then we had other questions to understand, to screen for some of their digital behaviors. So thank you to the Sonder team to help us really bring it together.
Great. We just had a question come in. What are some of the challenges in utilizing the segmentation tools and the entire activity? So maybe that's a good question. Dr. Sada, you could chime in on some of the challenges, and then maybe if our friends from Quicksand and Dakotas could also chime in.
Yes, thank you very much, Amanda. So I think I mentioned one of the challenge, which we had a solution with the dashboard. I think one key challenge is really very busy officials doing this planning to sit down and have the time to understand the data and the report and the segmentation, and how some of the language in the documentation, in the segmentation, was a bit challenging, least difficult, most difficult, more vulnerable kind of thing. But creating the dashboard really solved that. It was really easy for the state to now look at, okay, when you group these women and they are called unreached fatalists, we know that they are unreached because some of the vulnerabilities are clear, and we know some of their behaviors is fatalistic, and we can be able to target them with information. I think that is one key challenge. There are other challenges that were faced, but I think basically in the practical sense, that is really the most, the key one that we had to find a way to resolve before we move forward.
Thank you for answering that. All right, Babitha, I just saw you come off mute.
No, I was just gonna say, I think as much a challenge as well as an opportunity. There's so much richness to the vulnerability drivers, etc., within the pathway segments. And then when we also have a lot of richness within the digital behaviors. So as we build out the personas, we think there's a lot to work with and to really understand how the segments map to the personas. It's not going to be easy, but we're also excited about the possibilities that it'll throw up.
Thank you.
And from the Dakota side, working with the segments has been incredibly helpful. I mean, first, it's made sure that we are driving down market. I think that that's in knowing that we're sampling in this more vulnerable population up front. That's been really, really helpful because a lot of times you really don't know. And I'm an economist and you say, oh, I think in terms of income, and that's not what the pathways are, segments are thinking about. But it's also challenging as we are looking at our data across the segmentations. We're constantly cross-checking ourselves about, wait a minute, is that right? Does that make sense? And we can see that vulnerability right away. So in trying to look at data, it's really putting us, it's making us more thoughtful. It's building that thoughtfulness in the vulnerability segments into how we're looking at data from the very beginning. It's not a cross-check. It's built in from the beginning, and then we're able to start thinking, is this somewhere where digital behavior and access actually transcends vulnerability, or does it definitively not? And does that even make sense? We're immediately able to start thinking about that right away. And that's one of the huge benefits of working with pathways.
Thank you. Thank you, Daryl. All right, we've got one last question in the chat that I think we have time for Dr. Sada to answer. How is the state planning to continue utilizing the dashboard going forward? Okay. And then is there now more of a routine? So maybe 30 seconds.
Yes, thank you very much. So the state has already moved to develop an operational plan, an annual operational plan, and the information, with the dashboard will be able to continue to support it, to iterate, learn, and then adapt to what it is doing. Perhaps more regular updates to the data, to the dashboard, will be very critical for that. But as of now, they're already using it for their annual operational planning, which is going to be done every year.
Oh, that's great. That's great. Thank you. Thank you to everyone, especially our presenters. Excellent presentations, some really good discussion. I wish we had more time, but I think that we can continue these discussions throughout the Pathways community. I just want to share a few brief engagement updates. If you've not already, please sign up to receive our bi-monthly Inside Pathways newsletter. In each issue, you'll read more practical examples on how Pathways is being used to strengthen health strategies, policies, and projects around the world. Each issue has technical updates from the Pathways team, has other stories from the community, and also events that are upcoming, such as future webinars. We're also excited to launch our Pathways Community Resources site. Maybe I can ask some of my colleagues to drop the sign up for the newsletter and for the site into the chat. Through the site, you'll be able to catch up on the latest news from across the community, access past issues of the newsletter, and access recordings and slides from our webinars. If you're planning to attend World Health Summit in Berlin this year in mid-October, we hope that you'll join us. We're having a global health lab session focused on pathways. It's a chance to continue the conversation, hear fresh perspective, and engage with others. More details to follow on this, as well as an agenda and how to access it via live stream. We will also be hosting a reception with the Gates Foundation at ICFP in Bogota, Colombia this year. This will also be a great networking opportunity for many of you who I know who are planning to be there. So we'll share more details about that as we get closer to November. And before you sign off, there's a barcode here. If you could just please share your feedback on today's session. We've got 4 quick questions for you all. All right, I think that's a wrap. Thank you all so much for joining today. This was our first webinar. I would say it was a success. I wish you all a wonderful rest of your days and evenings, and we will continue the conversation through the Pathways community. Thank you.
Thank you. Thanks, Amanda.
Thank you.
Thank you, everyone. Bye-bye.